Medrizer Academy for medical assistance.
Management of a ICU thoracentesis patient. Assessment. Vital signs. Monitor blood pressure, heart rate and oxygen saturation level. Respiratory status. Assess respiratory rate, depth and effort. Listen to lung sound for any abnormalities. Pain assessment. Use a pain scale to assess the patient's level of pain. Dressing assessment. Inspect the dressing over the thoracentesis site for any signs of bleeding or infection. Monitoring. Continuous vital signs monitoring. Monitor the patient heart rate, blood pressure and temperature regularly. Oxygen saturation monitoring. Monitor the patient's oxygen saturation level using a pulse oximeter. Respiratory status monitoring. Monitor the patient's respiratory rate and effort. Observe for signs of respiratory distress such as increased work of breathing or decreased oxygen saturation. Chest tube care. Securing the chest tube. It is important to ensure that the chest tube remains properly secured to prevent accidental dislodgement. Use a securement device or tape to keep the tube in place. Monitoring drainage output. Regularly monitor the drainage output from the chest tube. Note any significant changes in volume or color, as this can indicate a potential complication or change in the patient's condition. Closed drainage system. The chest tube should be connected to a closed drainage system to maintain proper suction and prevent air from entering the pleural space. Ensure that all connections are secured and airtight. Assessing for complications. Keep a close eye for any signs of complications such as air leaks or kinks in the tubings. These can interfere with proper drainage and may require intervention or adjustment of the chest tube. Respiratory support. Supplemental oxygen. Provide supplemental oxygen as ordered if the patient is experiencing respiratory distress or has decreased oxygen saturation. Respiratory treatment. Assist with respiratory treatments such as nebulizer treatments or incendiary spirometry as prescribed. Pain management. Assessing pain level. It is important to regularly assess the patient's pain level following thoracentesis in the ICU. Administering pain medication. Based on the assessment, administer appropriate pain medication as ordered by the physician. This may include opioids or non-opioid analgesics depending on the severity of the pain and the patient's medical history. Mobilization and ambulation. Early mobilization and ambulation are important for patients' chest injuries following thoracentesis in the ICU. Encouraging patients to move and walk as tolerated can help prevent complications such as pneumonia and deep vein thrombosis. Health education. Regarding the procedure, it is a procedure to remove excess fluid or air from the pleural space in the chest. It involves inserting a needle or catheter into the chest and draining the fluid or air. Expected outcome. The thoracentesis procedure can help improve breathing and relieve symptoms caused by the excess fluid or air in the chest. Signs of complications. It is important to monitor any signs of complications after the thoracentesis procedure. such as severe pain, shortness of breath, fever. Communication with the healthcare team. Any changes in the patient condition to the healthcare team, including increase in pain or discomfort, worsening shortness of breath. Psychological support. Addressing fears and concern. Provide emotional support to the patient and their family by addressing any fears or concerns that they may have. Facilitating communication. Facilitate communication between the patient, their family, and the healthcare team to ensure that all parties are well informed and involved in the patient care. Thank you. For more videos, please follow.